Hi, Dr. Jim Jamison here with Youngstown Orthopaedics, here today to talk with you about another topic in joint replacement surgery. Today we're going to talk about knowing when it's time for a joint replacement. When a patient comes in to see me for pain in their hip or knee, I go through my usual checklist of questions. How much pain is the patient having on a scale of 1 to 10? Are they having pain when they sit at rest? Are they having pain that affects their ability to sleep? Do they have pain when they walk? If so, how far can you walk? Or how long can you be on your feet before you have to stop and sit down? Do you have trouble going up and down stairs and getting up and down from a chair? And if you have trouble on stairs, are you taking them one at a time? Once we establish that information, the next thing is to go through our conservative treatment options. Has the patient tried anti-inflammatory medicines? Have they tried exercise, or have they been to physical therapy? For knee arthritis, have they tried a knee brace or a knee sleeve, or maybe a cortisone injection from another doctor? Or maybe there's reasons that because of their medical history, there's some of those options, or maybe more than one, that aren't a good consideration because of other medical problems. We have to figure all that part out. The next thing to determine is, how much is the pain really affecting their life? Are they avoiding social activities or family functions because they just have too much pain to leave the house? Are they missing playing with their grandkids, or maybe going to their baseball games because it's too hard to get up and down the stairs at the ball field? Are they avoiding going to the grocery store or cutting the grass because it's just too painful? Is it affecting their ability to work or earn a living? Are they unable to sleep? If you find yourself in one of those descriptions, then maybe it's time to consider a joint replacement. The important things to keep in mind about joint replacement surgery is that they are elective operations. It's not an operation that you have to have. It's not a life and death issue. It's more of a quality of life issue. How much is your hip or knee pain affecting your quality of life? Is it decreasing your quality of life enough that you're ready to consider a surgery? That's the big question. Some patients seem to think that the surgeon, me for instance, should tell them when it's time for a surgery, or that their family should help them decide. Actually, the opposite is true. The patient is the one who needs to make the decision. When the patient has made the decision to proceed with joint replacement surgery, having tried all their conservative options and really thought about how much trouble they're having, and they're really ready to be successful, that's what spells success and brings a very happy outcome for the patient. If you're having a problem with your hip and knee, come see me at Youngstown Orthopaedics and we'll have a look and see what's going on. Thanks very much. This is Dr. Jim Jamison. We'll talk to you next time with another topic in joint replacement surgery.